All of the topics are very comprehensive. It has actually enlightened a lot of the audience in trying to bridge the gap between clinical practice and the guidelines that are available for hypertension, for chronic stable angina, and other cardiac diseases.
This conference is very informative. We've learned a lot of information and new guidelines and practices from other countries that we could apply here in our country, in the Philippines.
Very applicable to our practice as an internist and as cardiologists. So, lectures are very practical to use and very understandable.
We like the topic because they discuss also the guidelines that we usually apply when managing patients. So we get some views from other cardiologists too, and other ones who are managing same patients also.
I'm a trainee, but with the help of other professionals in the field, maybe I could apply some of the guidelines that they're talking about, and the new guidelines from different parts of the world. Yeah.
Hi, I found the topics very interesting. They weren't that complicated that as a resident I wouldn't be able to understand them. Actually, the topics presented or the dilemmas presented are very much present and in our everyday encounters in the hospital.
We learned a lot today just for the first day of this conference, so we hope that you'll be back to share more information, more practice guidelines in the future.
And glad to be here because it's very informative. And it's very useful in terms of clinical practice, as the title goes, in terms of bridging the gap between guidelines and clinical practice.
I like what they call the GBEM. What is stand for the guideline directed evidence-based medicine treatment.
Hopefully applying all of their teachings into my practice, in my future practice and my current practice as well.
I'm privileged to be updated of the current guidelines and treatment options for our patients.